Those are very common on the board. Pneumonia. Pneumonia is very common topic, and usually the question is not like kind straightforward, you know, loop pneumonia, streptococcus, and yeah, let's treat with ceftriaxone or third generation cephalosporins. But the question will be kind of small trick there. It's very small one. Like they tried the antibiotic but the patients look sick, or it's the season for RSV or the season for flu, and this patient really a high risk for flu and viral infections. At that time, yes, you need to understand that you need to add an antiviral therapy and the indication for antiviral therapy. One of the common questions is the RSV, and you need to do the PCR test, nasal, came back positive. Then you start giving them oral systemic ribavirin. It's not going to be the racemic, it's not going to be the inhaler ones, and it has to be the oral ribavirin. The people on risk for high risk for flu, COVID, RSV, those people are going to get that treatment. They are the immunocompromised. They are the people with structural lung disease, IBF, interstitial lung disease, already has a core pulmonary, age above 64, pregnant lady, especially with recent delivery up to 2 weeks, diabetic, and other significant cardiovascular disease, kidneys transplant, advanced CKD, dialysis, liver cirrhosis and liver disease, some patients with hematologic disorders or chronic anemias and obesity. Uh, BMI more than 40 is one of the risk factors. One of the scenarios will be symptoms of upper respiratory tract infection with runny nose. Then the course complicated with pneumonia. There is an infiltration on the chest X-ray, and they screened him with the nasal viruses and came back positive for flu A. Then what's the next option will be the answer. They will give you a couple of answers. The right one is to use oseltamivir, Tamiflu. It's not going to be the zanamivir because it's going to increase the risk of bronchospasm, and you don't need that for this kind of patients. There is also a common slide that come with babesiosis, intracellular X or intracellular Maltese cross. The diagnosis will be just spot diagnosis. Mycobacterium avium complex, there is some questions about that, and sometimes they're gonna tell you and give you the diagnosis and they will ask you what's the treatment. Usually, the prophylaxis is just azithromycin, but or clarithromycin, but the treatment has to be at least three antibiotics, including a macrolide, azithromycin, or clarithromycin, in addition to ethambutol and rifampicin or rifabutin. So you need to know, is it a prophylaxis or we are treating the patient for treatments three antibiotics. HIV, one of the common topics, and we will have a different slide for the HIV. But if you have a patient with an HIV and he's starting to have worsening neurological symptoms or have any focal neurological deficits, altered mental status, encephalopathy, you have to think about multifocal progressive leukoencephalopathy, the JSA virus. You need to do the CAT scan. There is no lesion and there is no mass-like lesion, or there is. Then you think about this viruses. Yes, the treatment is supportive, and you have to improve their immunity with resuming antiretroviral therapy if they were non-compliant or not using them. And once their immunity is resumed, and that's should be helpful. Toxoplasmosis also another HIV patients or immunocompromised, and they came with altered mental status, focal neurological deficits, stroke-like syndrome. You do the CAT scan and you see an image with a mass-like. This one need to be treated with sulfadiazine pyrimethamine. Uh, in my slides, you're gonna see the number of pages. This is when you go back to MKSAP, the board review, and check it online or download it or look at it. This book is very good for board review or the internal medicine. Uh, Myself, I studied from MKSAP Board Basics, and I used Mid Study as a very good source, uh, very recommended. C. diff is very common in the exam, especially the patients with severe or recurrent C. diff. So the question will be: is this? You're gonna ask yourself: is this is a recurrence infection or is it severe infection? Once it's the first attack and it's not severe, then just oral vancomycin should be. Second attack and it's not severe, oral vancomycin or fludroxymycin. Third attack, it's the time when you need to do some transplant, microflora transplant. And the severe attack means there is a kidney injury, there's hypertension, there's systemic symptoms, the patient with toxic megacolon or this, then you need to add to the oral regimen an IV flagyl or metronidazole.